Factors affecting the reliability of muscle strength testing. Isokinetic muscle strength testing is an accurate and advanced method for assessing muscle strength. Using an isokinetic dynamometer, it is possible to measure the torque or power produced through concentric or eccentric muscle actions. Example, if isokinetic dynamometers are Biodex, Contrex, Cybex, and Kincom. In isokinetic testing, the movements are performed at pre-selected type of muscle contraction, which can be concentric or eccentric. The movements are performed at a constant velocity. For example, the velocity can be set at 60 degrees per second or 240 degrees per second. Isokinetic muscle strength testing is regarded as the golden standard of muscle strength assessment. It provides precise measurements in a controlled environment. The device measures muscle strength across the entire range of motion. However, the equipment is large and expensive, which limits its accessibility for routine use.
Handheld dynamometer is used for assessing muscle strength. Common brands include MicroFET 2, Lafayette, PowerTrack 2, Jamar, and Muscle Meter. During testing, the tester holds the dynamometer while the client performs a maximal effort against it, and the peak force produced can be read from the display. Handheld dynamometer is small and cost-effective device for assessing muscle strength. The device is simple and quick to use. However, the reliability of the testing depends heavily on the tester's professional skills and experience.
In general, the repeatability of isokinetic muscle strength testing is good, particularly in the assessment of lower limb strength. The repeatability of handheld dynamometer has shown greater variability across studies. When measurements performed with isokinetic and handheld dynamometers have been compared, some studies report highly consistent results between the testing devices, whereas others have indicated larger differences, especially in knee extension strength testing.
Regardless of the testing device, for the results to be useful, their reliability must be at a high level. It means that the testing repeated under similar conditions should give comparable results. The reliability of testing can be improved by carefully considering factors related to it during planning and execution of tests. Muscle strength tests are often performed by biomechanists, exercise physiologists, testing specialists, physiotherapists, podiatrists, or other professionals with appropriate training and device-specific expertise. The success of the testing is strongly linked to the tester's professional skills and experience.
It is recommended that testing devices are maintained and calibrated according to the manufacturer's service program and at the service intervals specified by the manufacturer. Checking the technical condition of the device and performing regular maintenance are essential to ensure that the device operates safely and predictably. During servicing, worn parts and faulty sensors are replaced, and any mechanical defects are repaired. To ensure that a muscle strength testing device provides reliable results, it must be calibrated before use. Each device and manufacturer have its own calibration protocol, which is usually described in the user manual. Calibration confirms that the device is functioning properly and that the results accurately reflect the actual performance of the person being tested. A device that has not been calibrated may give incorrect values. This can lead to misinterpretation of results and false conclusions about a client's performance, functional capacity, or rehabilitation progress. In addition to the regular servicing and calibration, the tester should always verify before each test that the device is functioning as expected.
Before the actual test, it is important to control the testing environment as carefully as possible. The temperature of the testing room should be kept stable. Ideally, the temperature is around 20 to 22 Celsius degrees. Adequate ventilation and lighting must also be ensured. During testing, the room should be arranged so that the noise level and other potential distractions can be minimized. Creating a comfortable and well-controlled environment helps the client concentrate on the task. It may also reduce tension or anxiety during the test, and thus increase the reliability of the test.
Ensuring the client's safety during muscle strength testing is a key element of high-quality testing. Before beginning the testing, the tester must confirm that the client is suitable for testing. This includes reviewing the client's overall level of physical activity, general health status, current medications, and any acute health issues. The tester also verifies that the client has no limitations in range of motion or neuromuscular control that would prevent proper execution of the test movement. Also, it must be ensured that the client understands the instructions and is able to follow them. These procedures ensure that both the testing process and the physical load involved are safe for the client.
In muscle strength testing, the testing position is crucial for reliability, safety, and the accurate interpretation of results. The position must take into account the basic posture of the body, e.g., sitting, the position of the tested limb, as well as appropriate fixation and support of both the body and the tested limb. The client should be supported and secured firmly enough in the starting position so that no unnecessary movements occur during the effort, which could otherwise affect the results. For example, in isokinetic testing of the lower limb, seat adjustments and straps are used to prevent trunk movement. This ensures that the force produced is directed solely at the muscle group under examination. The tested limb must also be correctly fixed and supported. When measuring knee extension and flexion with an isokinetic dynamometer, attention should be paid to the alignment of the device's axis of rotation, the correct placement of the ankle adapter, and the proper length of the lever arm. By establishing a correct basic posture and accurately positioning the tested limb, it is possible to ensure that, during a knee extension flexion test, the testing truly reflects the maximal strength of the knee extensor and knee flexor muscles, and the other muscle groups are not involved. Testing results can only be regarded as reliable if the testing position is carefully controlled. Also, the seat adjustment, settings, and placement of supports should be documented so that they can be replicated in follow-up tests.
A prerequisite for the reproducibility of muscle strength testing is a standardized test protocol. It is a predefined, detailed set of instructions describing how the test is to be performed in exactly the same way each time. The purpose of a standardized protocol is to eliminate variation, which is unrelated to the client. A standardized test protocol covers every stage and factor that may influence performance. These include, for example, the testing position, device settings, warm-up procedure, number of repetitions, recovery periods, instructions, and motivation provided, the use of straps and supports, the order in which limbs are tested, the length of rest intervals, and the timing of the test in relation to other physical loading.
The timing of the test can influence the results, as maximal muscle strength has been shown to vary slightly throughout the day. This variation can be minimized by scheduling repeated testing at the same time of day. The training load preceding muscle strength testing also affects the outcome. If the test is performed too soon after an intense training period, the muscles may not have fully recovered. In that case, the recorded strength values may underestimate the individual's actual performance. Short-term physical or mental fatigue reduces maximal performance. The client should therefore be well rested, with no strenuous training or significant mental stress within the preceding 24 hours. Similarly, if one test session includes 2 test sets and another 5 sets, fatigue will affect the client differently. The tester should follow a predefined testing protocol. For example, an isokinetic testing protocol might specify a 10-minute warm-up, 3 maximal repetitions at a velocity of 60 degrees per second, and a 2-minute recovery between sets. When planning the standardization of testing, it is important to control the client's nutritional status and medication use. Any factors that may influence performance should be identified and documented for reference in repeated tests. These factors can be such as caffeine intake or pain medication. Warm-up has an impact on the results of strength testing. For example, if a client performs a test without warming up in one test session and completes a 10-minute cycling warm-up in another, the results will not be comparable. As an example, Zhou et al. Demonstrated that male swimmers who followed the FIFA 11 Plus warm-up program improved their knee flexion strength levels in isokinetic muscle strength tests compared with swimmers who performed a standard warm-up routine.
The test session is often new for the client and may also feel technically challenging. If the client is unsure how to perform the movement or what is expected, they may produce an overly cautious or incomplete effort. Consequently, the tester's professional skills and experience are critical for providing clear instructions and motivating the client to achieve their best possible performance. The wording of the instructions can significantly influence the results. For instance, whether the tester directs the client to perform the test as hard as possible or as hard and as fast as possible will lead to different test performance. Motivation is one of the key factors in measuring maximal strength. A client's capacity to generate force is not determined solely by physical strength, but also by their voluntary effort to exert themselves fully. Earlier studies have shown that verbal encouragement during strength testing enables clients to produce greater muscle force. In addition, good interaction between the tester and the client, along with constructive feedback during testing, often helps to reduce uncertainty and improve the quality of performance.
A strength test can be new and technically challenging for the client. Often, the first testing session does not provide the most accurate picture of a client's maximal performance, as the movement pattern and equipment are not yet familiar. For example, Dernberg et al. Reported a 3 to 5% learning effect in isokinetic concentric peak torque of knee flexion during the second and third test sessions compared with the first. Hence, practicing the movement before the actual test frequently improves the reliability and reproducibility of the results. The learning effect may also be reflected in the number of repetitions required during the testing. Costa et al. Found that in concentric muscle actions, 37 to 40% of swimmers, and in eccentric muscle actions, 18 to 24% of swimmers needed more than 3 repetitions to reach peak torque. Familiarization with the testing procedure before the actual testing, combined with clear instructions, helps the client master the technique and significantly enhances the quality of the test.
During the actual testing, the tester continuously observes the client. The tester monitors the movement pattern, the targeting of the movement to the correct muscle group, and overall body control. In addition, the client's general condition is observed. The tester instructs the client to immediately report any pain, dizziness, or other unusual sensations during the test and is prepared to stop the testing if necessary. For example, if the client experiences knee pain, they may not be able to perform the movement through the full range of motion or with maximal force. If pain is detected, the tester can adjust the range of motion or select an alternative movement speed. After that, the testing can potentially be completed without discomfort.
The reliability of muscle strength testing is determined by a combination of factors related to the measuring device, the client, and the tester. Careful advance planning of the testing situation, including appropriate equipment preparation, clear instructions, and standardized protocols, can significantly enhance the consistency and trustworthiness of the results.
Thank you for your attention. This video was produced as part of the Move On project and is co-funded by the EU.